Anxiety is an emotional response characterized by a state of alertness and preparation for a danger that comes from the environment. It can involve physical and behavioral changes. Let's see better what it is in today's video. Hello and welcome back to Med4 Care. Today's topic is the anxiety. It is important to distinguish when this response is physiological and when it is pathological. A certain level of anxiety is physiological and is due to the activation of the autonomic nervous system. It alerts us to dangerous situations or helps us better prepare for a performance. In this case, therefore, anxiety may be an appropriate response. Instead, it is defined as pathological when it is not triggered by a stimulus or when its intensity is exaggerated and can generate a state of anguish and intense discomfort in the individual. Anxiety can become disabling, as the patient gets to put in place protective mechanisms to avoid any situation that could cause him that feeling. This behavior can lead to an anxiety disorder. Unlike fear, which is a response to an imminent threat, anxiety is the anticipation of an unaddressed future threat. Anxiety disorders are the most common and extensive mental problems in the general population with a prevalence of about 18%. They generally occur more frequently in women aged 20 to 30, and then decrease with advancing age. The most common disorder is phobia, while the one that may require urgent medical attention is panic attack disorder. What are the causes of anxiety? The causes of anxiety can be different and vary from person to person. It can be caused by biological, psychological, or social factors. Among the most common we find stressful events, such as a job change, divorce, death of a loved one, genetics. Some studies have shown that these disorders are more likely to occur in different members of the same family. Past traumatic or difficult experiences, such as abuse, bullying, violence. Other mental health issues. Lifestyle, such as alcohol or drug use, smoking, poor diet or lack of exercise. As those related to the thyroid or menopause. Now let's see what the symptoms of anxiety are. Anxiety can manifest itself in several forms, including excessive worrying, obsessive thoughts, agitation, difficulty concentrating, sleep disturbances, muscle tension. One symptom that deserves special attention is that of panic attacks. These are isolated episodes of intense fear and discomfort, sudden onset and self-limited, with peaks of 5 to 15 minutes and occur in the absence of real danger. They are associated with at least 4 of the following symptoms: palpitations or rapid heartbeat, sweating, tremors, feeling of suffocation or asphyxiation, chest pain, nausea, feeling dizzy, feeling of unreality or detachment from yourself, fear of losing control or going crazy, fear of dying. These crises can occur unexpectedly or be related to certain triggering situations. We have seen that when anxiety is pathological and disabling, it can lead to anxiety disorders which, according to the Diagnostic and Statistical Manual of Mental Disorders, the famous DSM-5, include different types. We have panic attack disorder, which can implement behaviors aimed at preventing its reappearance, the so-called avoidance behaviors. These behaviors can cause important changes in the subject's life and compromise normal daily activities. Usually the first attacks arise without triggering elements, but later they can be associated with stressful situations, increasing avoidant behaviors. Then we have phobic disorders. The most frequent are towards animals or insects, or due to environmental stimuli such as storms, the sea, height. Phobias for blood or wounds. Phobias due to situations such as taking a plane, a train, or taking an elevator. A particular type of phobia is the social one, in which the subject feels insecurity, panic and persistent fear in situations of social exposure, such as speaking in public, eating in public places, talking to strangers. In these cases, the patient fears being judged negatively by other people. As in all phobias, fear and anxiety are disproportionate and the individual realizes it, but fails to dominate them. Most people with this disorder first had symptoms in their teens, often following humiliating events. Another anxiety disorder is agoraphobia, an intense anxiety that is generated when you are in public spaces, in the presence of many people. In places where escape may be difficult or embarrassing. Places where you think you cannot be helped if necessary. We then come to generalized anxiety disorder, characterized by a state of excessive chronic anxiety and concern, not directed at specific and concrete situations, but which extends to all daily activities. It is a pathology that tends to become chronic and to be associated with depressive symptoms. Finally, we have the anxiety disorders of childhood. Among the most common we find selective mutism, equivalent to the social phobia of adults. There is a child's difficulty speaking in specific social situations, such as school or family gatherings. However, the child may speak normally in other situations, such as at home or with close friends. It is often associated with symptoms of social anxiety, which could be a fear of being judged or criticized by others. The disorder can negatively affect a child's life, causing communication problems and social isolation. Diagnosing selective mutism requires evaluation by a mental health professional, and can be tricky, as this disorder can be mistaken for simple shyness or a refusal to talk. Among children, we also find separation anxiety disorder. The child experiences a very strong panic when he is separated, really or not, from people with whom he has a strong emotional bond. The child suffering from this disorder may fear harmful events, not want to go to school, not want to be alone, have nightmares, complain of somatic symptoms. Now that we have seen the various types of anxiety, let's get to its diagnosis. Part of the diagnostic process is the medical history. The goal is to obtain detailed information about the circumstances, symptoms, and risk factors that may have contributed to the development of the problem. Following the history, the specialist may proceed with a physical examination, which focuses on evaluating the person's physical and behavioral symptoms. May include evaluation of heart rate and blood pressure to rule out any heart problems. Examination of the airways and lung function. Evaluation of muscle activity and tension. Assessment of tone of voice and breathing to rule out any phonation or breathing problem. Observation of behavior and facial expressions to assess agitation, worry and fear. A cognitive behavioral assessment can be used to assess the person's thoughts, emotions, and behaviors and to identify dysfunctional patterns of thought that may contribute to the problem. Another important aspect is the differential diagnosis of anxiety because there are several pathologies that can mimic a panic attack. There are also other psychological conditions that can be confused with anxiety. For example, endocrinological diseases such as hyperthyroidism, cardiac pathologies, neurological diseases, mood disorders such as major depression, which can cause symptoms such as sadness, loss of interest and fatigue, obsessive-compulsive disorders, post-traumatic stress disorder, somatoform disorders, such as somatization and hypochondriasis. Well, let's see now how we can treat anxiety. There are psychological therapy and drug therapy. However, lifestyle changes and some relaxation techniques are also important. In general, treatment is personalized and time and patience are needed to find the most suitable solution for each individual. We find cognitive behavioral therapy, which focuses on changing the thoughts and behaviors that can cause this disorder. Therapy may include techniques such as challenging negative thoughts, cognitive restructuring, and gradual exposure to anxiety-provoking situations. Dialectical behavior therapy, which focuses on accepting negative thoughts and feelings and managing emotions more effectively. Exposure therapy, which involves gradually exposing the patient to anxiety-provoking situations, with the aim of reducing the fear and associated anxiety. Psychodynamic therapy, which focuses on identifying unconscious behavior patterns that may contribute to anxiety. It may include analyzing dreams, recalling traumatic memories, and investigating personal history. Now we come to drug therapy. Anxiolytics, usually benzodiazepines, are drugs that act on the central nervous system to reduce symptoms of anxiety. However, these drugs can be very potent and addictive, so they should be prescribed with caution and used with professional supervision. Antidepressants can also be used to reduce anxiety. They take several weeks to become effective. Beta-blocker medications can help reduce the physical symptoms of anxiety, such as sweating and palpitations. It should be noted that they have no effect on feelings of anxiety or fears but only on the resulting physical appearance. There are some lifestyle changes that can help reduce anxiety. Regular physical activity, balanced diet, reduction of alcohol and drug consumption, improvement of sleep quality, socialization. Other strategies that can reduce anxiety and stress are relaxation techniques. We have deep breathing. It involves controlling your breathing, avoiding breathing through your mouth but slowly inhaling through your nose and exhaling through your mouth, focusing on your breath. This technique can help reduce muscle tension and improve oxygenation of the body. Meditation involves focusing on breathing and the sensations of the body, trying to free the mind from negative and stressful thoughts. Guided visualization involves imagining relaxing images, such as the sea or nature, while focusing on your breathing. Massage, it can help reduce muscle tension and improve circulation. Music therapy and finally yoga. Anxiety is physiological and is part of all those mechanisms that are activated to stay alert. It allows us to avoid danger and improve our performance by being more prepared. However, it can become pathological when its intensity is disproportionate to the situation, creating situations of unease and excessive discomfort. After an accurate diagnosis, the existing therapies, both psychological and pharmacological, are varied and can help reduce symptoms and learn to manage anxiety. We have now reached the end of today's video. We hope you enjoyed it. See you soon on Med4Care.